This presentation for the 2020 Guidelines and Updates for ICD-10-CM was created by students at Cuyahoga Community College for a group project. This section will cover the chapter-specific guidelines for Chapter 15. Chapter 15 is for obstetrics. The codes begin with O. They go from O00 to O9A. Codes from this chapter are only used on the maternal record, never on the newborn record. If the patient is admitted during one trimester, but discharged during a different trimester, the code assigned for the antepartum complication should be based on the trimester when the complication developed. So if the patient was admitted for a complication during the first trimester, but discharged during the second trimester, then you would code for the first trimester. The final character indicates the trimester in the majority of the Chapter 15 codes. The final character for fetus identification is also a possibility on some of the codes where fetus identification is necessary. When selecting the principal diagnosis for an obstetric encounter, you need to consider what necessitated the encounter. If it was a routine outpatient prenatal visit, code Z34 is used. Supervision of a high-risk pregnancy, O09 is used. An episode when a delivery occurs with no complication would use code O80. A code from the category Z37 would be used to indicate the outcome of the delivery. Pre-existing conditions in pregnancy. Some codes in this chapter will distinguish between conditions that existed in the mother prior to the pregnancy and those that are a direct result of the pregnancy. This chapter also contains codes for fetal conditions affecting the management of the health of the mother. Code O35 is maternal care for known or suspected fetal abnormality or damage. These codes are used when the fetal condition is responsible for modifying the management of the mother, not just that the fetal condition exists. Code O35 is also used when surgery is performed on the fetus. If a patient is admitted for an HIV-related illness while they're pregnant, the principal diagnosis will be code O98.7 for the HIV disease complicating pregnancy. The secondary diagnosis would be the code for the HIV-related illness. If a pregnant patient has asymptomatic HIV infection, you still use code O98.7, but then the secondary diagnosis would indicate Z21, asymptomatic HIV infection. If a pregnant patient has diabetes, they would receive code O24 as their principal diagnosis if the treatment is for their diabetes. Then the secondary diagnosis would be from category E08 through E13 to indicate the appropriate type of diabetes. Gestational diabetes is diabetes that only occurs in the mother during the pregnancy. This is coded with O24.4. Chapter 15 also contains codes regarding alcohol, tobacco, and drug use during pregnancy. Code O99.31 indicates alcohol use complicating pregnancy. If this is assigned, then secondary code F10 should be used to identify the manifestations of alcohol use. Code O99.33 indicates smoking complicating pregnancy. This should be assigned when the mother is using tobacco products during her pregnancy. This also would require a secondary code from category F17 to identify the type of nicotine dependence. Likewise, code O99.32 for drug use complicating pregnancy would require a secondary code to identify the manifestation of drug use. Code O9A.2 would indicate injury, poisoning, and certain other consequences of external causes complicating a pregnancy. This code should be followed by the appropriate injury, poisoning, toxic effect, adverse effect, or underdosing code, and then additional codes specifying the condition that was caused by the poisoning, toxic effect, adverse effect, or underdosing. Here's a question. A patient is admitted for accidental carbon monoxide poisoning from car exhaust. The patient is 18 weeks pregnant. What is the proper way to code this? Option 1, toxic effect of carbon monoxide from motor vehicle exhaust, accidental initial encounter as the principal diagnosis, followed by the secondary diagnosis to indicate 18 weeks of gestation of pregnancy. Or option 2, principle of O9A.212, injury, poisoning, or other consequences of external causes complicating pregnancy, second trimester, followed by the secondary diagnosis code of the toxic effect of carbon monoxide and the code indicating 18 weeks of gestation of pregnancy. The answer is option 2. For pregnant patients, an O code is almost always the principal diagnosis. Delivery is another thing that needs to be coded. For a normal, uncomplicated delivery, code 080 would be used. If any other code from Chapter 15 is included, then you cannot use 080 because it is no longer considered a normal delivery. You'll also need to provide a code to indicate the outcome of the birth, such as Z37.0 for a single live birth. In this chapter, you will find codes that indicate that they are referencing the postpartum period or the peripartum period. Postpartum begins immediately after delivery and continues for 6 weeks. Peripartum is from the last month of pregnancy to 5 months postpartum. Code Z39.0 is the code that will be used for an encounter routine postpartum care of the mother. Code O94 is for a sequela of complication of pregnancy. It can be used at any time after the initial postpartum period. It's used for cases when an initial complication of pregnancy develops a sequela which requires care or treatment at a future date. O94 is to be sequenced following the code describing the sequela of the complication. Termination of pregnancy codes are also included in this chapter. For retained products of conception following an abortion, principal diagnosis of O03.4 would be used. This is for an incomplete spontaneous abortion without complication. Or code O07.4, which is a failed attempted termination of pregnancy without complication. A Z code would be used to designate the outcome of the fetus. So an abortion with a live-born fetus, you would use code Z33.2 or encounter for an elective termination of pregnancy, but the secondary diagnosis would be Z37 for the outcome of delivery. Abuse in a pregnant patient also has codes within Chapter 15. There are codes that indicate whether the abuse is physical, sexual, or psychological, which is complicating the pregnancy. If you use any of these codes, they should be followed by appropriate codes to identify any associated injury which is due to the abuse. Thank you for listening. Please see the links in the description section for links to our other presentations.